Welcome to the module 3 of Dhanwantri. Today we'll be learning how to post patients for surgeries, how to update the OT list online, and how to update the surgical records. So we'll be going to ESI Gateway and then logging in with our credentials. Once we log in, we'll go to Health Information System. Within Health Information System, we'll be selecting our location and facility. After which, within Clinical Records, we'll be going to Inpatient or Emergency Patient Management. Within this, using the hospital inpatient search or by choosing the specific patients, we'll be finding out our patient who is posted for surgery. You can use Control or Command F in order to type your IP number or name in order to find the patient easily as well. So suppose this is the patient that we'll be posting for surgery. We will go to prescriptions. We'll go to health interventions or surgeries, and then we'll add a health intervention for this patient. Let's say it is hydrocele excision. So we'll see you have congenital hydrocele, hydrocele of cord, operations for hydrocele, unilateral, bilateral, or tapping of hydrocele. Suppose we say it is operation for hydrocele unilateral, and then the scheduled date is today. Today. And the surgery is in main OT, anesthesia is required. The approximation duration will be, let's say, 1 hour. The type of anesthesia, local anesthesia. Any remarks or special requirements? Since the site is not mentioned over here, we can mention the site over here. We can say right-sided lots ligation surgery. The priority can be set to either ASAP, routine, or STAT. Once we have done that, we'll click on Save and Close. We'll get the confirmation over here, and once you click, it should update on the patient. It hasn't updated. It has updated for the patient over here. You can see on 30th April 2017. The patient was posted for unilateral hydrocele surgery for right-sided LOTS ligation surgery. After which, if you want to see all of the patients that you have posted for surgery, you can go to OT list. Now, within OT list, you can see the request dates from which date to which date. So the request date is 30th April, and only one patient is posted from the surgical department, and you can see all of the different details that are written for the patient. Now, suppose I check yesterday's, you can see how a normal OT list actually looks. So all of the different departments will be posting. Here you have ophthal surgeries, you have dentistry, and you have plastic surgery, ENT, all of the OTs, whichever are there, they'll be updated over here. So we'll go to today's, and then we'll see. If an OT list is not updated, it will appear gray like this. Once an OT list is updated, then it will appear green. All right. So to update an OT list, basically after a surgery, you have to update all of the details. The details that we have to fill, we'll see over here. Once you click on this operations for hydrocele, it will show what are the next tasks. This PSC filling should be done by the anesthetist. So we'll be going directly to surgical record. And it will show an error saying that PSC is not done. Do we still want to enter surgical record? And we'll say yes, okay. And these are all of the details that you have to fill. You see the patient details over here in the first three sections, and then the surgery that was planned and surgery that was done for the patient. Then anesthesia start time. Suppose it started at 9 a.m. I'll be writing 9 a.m. over here, and OT. Suppose the operation happened in OT 8. The anesthesia given, as we saw, was local anesthesia. So whether it was with lignocaine and adrenaline or was it only lignocaine? We'll say it was lignocaine and adrenaline. The priority was routine, and the surgical type was major surgery. After which, you'll be selecting when the patient was entered into the OT complex, when the patient surgery procedure time started, surgery procedure time ended, and when the patient was moved out of OT complex. Now, suppose the patient was moved into OT complex at 8 and the surgery started at 9 after anesthesia was given. Since it's a 1 hour procedure, the surgery ended at 10 and the patient was moved from OT complex at 10:30. After this, you can click save, and then it will save all of these details. Okay, sorry. So anesthesia end date time I did not mention. So end date time I will mention as suppose say 9:20, 9:15. Let's go for that. And then we'll click save. And then it will save the whole thing. You can see data saved successfully. Now once we go back over here and once we reload the page, you will see that it is green now. So this means the OT list has been updated. The record for the patient, see, surgical record has been recorded for the patient. And gray means new request. If you click over here, the cancel surgery is there. If you click that, then it will be updated to this color. All right. So now how do we update the surgical record, what we did during the surgery? So for that, you have to remember this number, which is the patient's requisition number, which is 182145. You can copy that. I will remember it. And then you go to operative notes or OT notes. Over here, you search for the patient request number. You write request number 182145. And then you click search. And then you make sure this is the patient. Okay, I remember it is this my patient. The operation for hydrocele unilateral. We will select the patient. And once the patient is selected, the patient details is over here. Within notes, I will select surgery notes. And the template will start over here, all of that. So the doctor's name you can change. The second doctor or nurse's name you can write. The third doctor or nurse's name you can write. After that, you can write all of these details, what was performed, the position of the patient, the incident, preoperative findings, diagnosis of intraoperative diagnosis, description of intraoperative diagnosis, all of the different sections. Whichever sections you do not have to fill, you can leave it blank, and the other sections you fill, and then you click save, and then the OT record will be saved for that patient. All right, so that'll be it. Once a patient has been posted for surgery already, you can see over here, you can see an actual one that this patient was actually posted on surgery on 26th of April for hydrocele of cardiac session. So this is how it looks, health intervention. This is how it is recorded. This was a dummy on that we did for demonstration purpose. All right, that'll be it from this video. Thank you, and I'll see you again.